Okay, after lunch slot, so no pressure, Sharon from Healix and John from Workday to bring to life how the Health Trust is being used as a vehicle to specifically design and manage employee health risks. So over to both of you.
Thank you. Good afternoon. Hopefully after the lunchtime slot we will keep you awake. So without further ado, so John, what initially led you, Workday, to consider alternatives to traditional health insurance?
It's a good question. I mean, to be honest, we weren't really looking for a healthcare trust solution. I think we had a lot of challenges that we wanted to try and find solutions for, but the kind of traditional model of insurance we had just really didn't allow us to do that. So, I think within many of us in HR, you normally get people coming to you with solutions. We want you to implement a salary sacrifice car scheme, but no one kind of ever asks what's the challenge that we're trying to solve. So, we had a lot of challenges that we were kind of really trying to solve for our employees and the money that we were spending around healthcare. So, I mean, we had a fairly inflexible kind of scheme design, and each year as you kind of look at that scheme design, both us as an employer and our employees have very kind of difficult choices that they have to face.
Yeah.
So, if your employees use a physio a lot, how you kind of get your renewal is to make it harder for them to use the physio. And so that kind of really reduces the health outcomes for employees. And so we wanted to really kind of turn that on its head and kind of look at the areas that we wanted to invest in. Alongside that, within the insurance, there was a lot of stuff that was bundled in. So they'd bundle in EAPs, they'd bundle in discount programs, which maybe have a very tangential kind of relationship to the medical insurance, but we had global suppliers. So we ended up with 2, 3, maybe even 4 kind of versions of that. So there was a lot of money that was kind of being wasted and we weren't using it or our employees weren't using it. And that kind of takes me into the next point, which it started to become very confusing for employees to know, how do I access these medical services?
Yeah.
We probably had, through our EAP, through our fertility benefit, through our medical insurance, we probably had 3 or 4 different forms of counselling. And so the employee experience and how they actually access those benefits was really kind of difficult, and it kind of really stopped people being able to engage with the benefits that we provided. The way that I think about that is, when you go into a supermarket at 5 o'clock, you're hungry, and you see kind of 30 different variations of bread, and you just can't make a decision of, which one do I buy? And I think that's kind of similar to employees when there's lots of different counselling options that they have available, but they just don't know which way to go, and they're kind of scared of making a mistake. And then I think really, the final piece of that was kind of data. So we'd started to gather data. We were receiving data from our health screen provider, from our EAP. It wasn't so kind of regular or timely in the medical insurance. So as we were starting to kind of build out that picture and understand what are the areas that our employees are really struggling with, we just didn't have that kind of comprehensive picture.
Yeah.
And when I kind of reflect on it now and, what were some of these challenges that we were trying to solve? So, I kind of call it a doom cycle. So, our employees were stressed, and admittedly some of that is caused by Workday, but a very stressful environment, which, was leading to people having issues with sleep. And then when they're tired and stressed, they start eating stuff that they shouldn't be eating, or, their diet kind of goes out the window, which then leads to kind of musculoskeletal, which can lead to kind of addiction, which can lead to more stress, which leads to kind of worse sleep. So we were seeing that kind of come through fairly strongly from our health screening data, but we didn't really have a strong way of being able to help support our employees kind of break that
Yeah.
doom cycle. So lots of challenges that we were kind of dealing with, and we couldn't find a vehicle that would allow us the flexibility to remove some of that frictional cost that just didn't need to be there, while at the same time would allow us to focus on some of these kind of key areas where we knew our employees were struggling without having to keep reducing the benefits.
So what is it about our particular trust model that captured your attention?
Yeah, well, I think, insurance in general, like, it kind of works in a set way, and I think most people are kind of fairly clear. So, at Workday over the last kind of 5 years, we've replaced over 130 vendors who support our benefit programs kind of globally. So we kind of have a really good feel of what we're looking for. And we want someone who's going to be a strong partner for us within our business and who has a very kind of similar value set. So I wouldn't say, was it the Healix solution that kind of was different or kind of had a differentiator. But I think it was the team that kind of really made a difference. So as we kind of came to you with some pretty out there kind of suggestions, talking about having on-site nutritionists and sleep coaches and physios, there was a real kind of partnership approach. And your kind of medical team were kind of really switched on to work with us in a way that allowed us to kind of explore those options and how we made those available to our employees. And I think once we kind of started looking at the market and we knew that we were moving more towards a healthcare trust because of the flexibility that it offered, meeting the team and meeting the people was kind of, I think, the kind of key differentiator for us. So, the offices, the kind of technology, the people who are actually answering the phones to our employees. So that kind of knowing what we wanted, finding that partnership who would challenge us in a way that allowed us to think very intentionally about the solutions that we wanted to provide, and an area where we could form a really strong kind of working partnership was kind of really what kind of made us very clear that we wanted to work with Healix. And I think there's a kind of a common approach to how you treat your members and how we want our employees to be treated. And I don't necessarily see that kind of across the board. Sometimes it's just a large call centre, someone comes in, they don't know who they are. And kind of to go back to one of the original issues that we were trying to solve, when there's 3 or 4 different counselling services, we wanted someone who could directionally help our employees get to where they needed to get to as quickly as possible. So, with the kind of expertise of the call handlers as our employees are calling up, probably at one of their most vulnerable states, had a strong feeling that, we can get them to where we need them to get to as quickly as possible without them being kind of passed from 3 or 4 different vendors. So, that was key to me, and I think that's kind of what made the Healix model kind of really kind of stand out for me.
Okay. So since transitioning to a trust, what's been as you've expected, or what's been the unexpected?
Yeah, I mean, I'm a bit of a cynic around a lot of these kind of ROI metrics. So, I guess we didn't really know what we were getting into. But, what was kind of surprising for me was the kind of support that we got from day one. So setting up a healthcare trust is a very kind of different approach to what a lot of our internal teams were used to around medical insurance. So the support and guidance that we got from the Healix team supporting our legal and our procurement teams was kind of just really helped get us through that as quickly as possible. So we kind of knew where we wanted to go to, but these things can become a very big sticking point when us within benefits kind of understand what we're kind of getting into. Yeah. But the other teams kind of really don't. And I think the expertise in supporting us kind of through that process really got the relationship off to a great start. I'm not sure how we could have done that if we weren't kind of getting that, what I'd guess is intelligent consulting from your team. And I appreciate it's not their day job to help us set up a trust, but going through that the first time, that was kind of really, really useful. I'm surprised at how quickly our employees have started engaging with the services. So, as we look to build out, nutritionists and sleep coaches, counsellors, to try and end that kind of doom cycle. We have made it easier for our employees to engage with those services. I'm really pleased that all of those individuals, their calendars are booked out for months in advance. So now what we're seeing is we know where the problems are, and in a fairly quick time frame, we've been able to offer our employees the support that they need. And, kind of a personal story for me. So, I know most men probably won't go see the doctor. It's the last thing they ever want to do, and they won't go even if their arm is hanging off. And I'm pretty much the same. So I'm at work, pain in my back, and the physio literally sits about 2 feet behind me. So, it was almost impossible for me not to go see that physio. And actually, I went and saw them, and they gave me some stretching exercises and kind of really helped me kind of make my back pain disappear. So we know that these services are now, we're making it so easy for an employee to use the services that it's almost impossible for them to ignore it. And then kind of summer party after we launched our fertility program, I had kind of 4 individuals kind of come up to me, and they were just so thankful for the support and the wraparound support that we had provided to help them on their family forming journey. And it's not often, within benefits that you get people coming up to you who are really grateful and really excited and pleased for the benefits that you provide. And kind of hearing that feedback, knowing that we'd supported 4 mothers in kind of going on that journey was really amazing. And they were grateful not just for the kind of financial support that we provided them, but because we had kind of been very intentional about what does that whole engagement model look like. It had just been made so easy for them to kind of go through IVF, to talk to a nurse, to talk to a specialist, who was helping guide them and making sure that they were comfortable at every step of the way. So.
And do you feel, John, that those benefits that you've been able now to offer your employees through a trust potentially wouldn't have been offered through a sort of traditional insurance?
Yeah, I mean, Workday, like a lot of HR, a lot of technology companies, we're competing against Salesforce and ServiceNow, Adobe, Amazon, Google, Microsoft. So, I mean, I think we've struggled, and this was a question we were asking for a while, of how can we provide these services in a way to employees that really helps them. And we had the data to kind of back up that these were the issues that we were facing. So if we were relying on a more kind of traditional model, I think it potentially might have become unaffordable for us to offer those services. I also think we still would have been stuck with multiple layers of how do I get to the place that I need to get to as quickly as possible.
Yeah.
And also our employees feeling that they were talking to, an expert who knew what they were doing to help them kind of get there. So, I like what medical kind of insurance can do, but I think when we see in the market and the environment that we are, medical insurance just becomes less and less helpful, and it becomes more and more costly. And that's not something you often see when you're buying stuff, that the price keeps going up, but the value in it kind of keeps going down. So, I think by using the trust model, being intentional about the services that we're providing, what was included within the trust, what was excluded from the trust, removing some of those frictional costs like the discount platform, the EAP, the telemedicine, kind of really allowed us to kind of offer something that is valuable and useful to our employees and their dependents, but is also kind of cost effective for them and Workday as well. So I don't think we would have been able to build those constructs and the support mechanisms for our employees if we were kind of within a kind of traditional insurance product.
So thinking about where you are now, John, with you've got you offer a lot of benefits to your employees already, and thinking about the trust model from a strategic point of view, where is Workday now looking to look at those more flexible benefits, those more personalised benefits? What's the next step?
Yeah, that's a good question. I mean, I think we're letting the data kind of guide us, and we continue to see kind of significant kind of stress and kind of that kind of whole doom cycle kind of still playing out. Now, I think we've made improvements within that space, but we continue to get much more intentional, much more focused about what we're offering. Is it working or is it not working? And trying to be as ruthless as we can to kind of remove some of those background noises. Because I think a lot of companies, 2019, 2020, they added a ton of solutions, point solutions. Maybe they were kind of extra generous around some of that. And we want to make sure that we are more focused. We're adding in the right kind of governance that we need on our program. So an example is we kind of moved up to 16 sessions of EAP. And I kind of think once an employee's had like 8 counselling sessions, they're probably not going to get better just by talking to someone. Now, they may do, but kind of is an extra 4 or an extra 8 sessions kind of really worthwhile for that individual? Or should we be looking at ways that we can get that person somewhere else that can give them the appropriate level of help and support? Maybe they need to be going into the NHS. Maybe they need some other level of treatment or medicine beyond just kind of talking therapy. So I think as we start to look at more of these pathways that we have, kind of female pathways, male pathways, kind of mental health kind of pathways, we can continue to kind of refine and kind of make sure that we are supporting employees have the right health outcomes for them.
And you mentioned data there, John, and data is a a hot topic for us all. Is there anything that you've been provided through the trust that has been enabled you to make some really good informed decisions around what you're offering employees as a healthcare benefit?
Yeah, I mean, I think the kind of MI that we get is quite enlightening. We're getting it on a quarterly basis, was a lot more frequent than we kind of had it before. I think once we start combining that with our health screening data, our EAP counselling data, our kind of income protection or absence data, like we're not really the experts in this space, and that's kind of what I really value by talking to your team and having those kind of strategic quarterly sessions. It's not just Workday saying we want to do this, because realistically speaking, I don't know that space that well. But having kind of professionals who are qualified in that space, who can help look at the data together with us and kind of validate if some of the recommendations or areas we're wanting to go to are the right way forward, helping us understand some of the unintended consequences and kind of a real kind of partnership-led approach. Because I think data's one thing, and we've all got tons of data, but it's actually being able to make kind of smart recommendations of what do you do with that data? How can we start to kind of be intentional, be targeted about the areas that we want to get into more to support our employees? And if we are offering benefits, are there going to be unintended consequences? Because we're kind of giving employees what they want, and not surprisingly, they use it, right? Which means that your costs could go up.
Which is good.
Which is good in one hand, but not good from a kind of financial kind of cost perspective. So I think making sure that if we roll something out that employees really need or really want, are we going to expect that 80% of them are going to be using it? And what does that kind of mean for us kind of going forward? Because I think once you've opened the door, it's very difficult to kind of shut it.
Yes.
And that's kind of, we've probably learned that and in setting up the trust from the beginning, where we were too generous too quickly and kind of see a bit of a reaction in our kind of claims data. So now we can kind of work with your team and kind of be focused on where we make those additions. Do we change something? Do we pull something back because the utilisation isn't there? Or do we continue offering more because we know and we can see our employees are using it and they're finding it very useful?
Great, thanks, John. So if there was any advice that you would give to others looking to move from insurance to a trust, what would that be?
Yeah, I mean, I think you need to come into this knowing, what are you trying to solve? And I think for us, we had kind of 3 or 4 kind of very clear issues at the beginning, which was access to that data, that there were some cost challenges, but improving the kind of claims experience. and making sure that we could offer benefits in a cost-effective and intentional way. So I think if you're just kind of coming at this and thinking, oh, we're going to save a little bit of money, that's probably not the way forward. But I think being strategic about this. This is not just a one-year thing. You know, it's not what you do in insurance where you switch from provider A to provider B because they're going to be cheaper. This is a longer-term relationship. And so what it's done for my team is allow us to be more strategic. We're not just onboarding a new vendor every year. We're not just kind of going with someone because they're 3% cheaper, but lack that ability to build that long-term relationship. Going into a trust is, you know, you probably need to go into it for at least 3 years, if not longer. And so that changes how my team operate. They are now more strategic. They are now more focused on the healthcare outcomes for our employees, as opposed to just trying to drive the price down as low as possible. And I think that is a significant kind of mindset shift. And, you know, I felt this kind of previously in other roles that I've done. You just become someone who gets very effective at the procurement process because you do it every year, and you're just trying to find, you know, a 1% saving kind of in one location. And, you know, often that's not delivering great healthcare outcomes for your employees, because to get those kind of cost savings, you're reducing or diluting the benefit. So, you know, for me, this is a very kind of strategic approach that we're taking.
Yeah.
And then finding, you know, the right partner, the right company who understands you and kind of is on the same page as you in terms of what you're trying to achieve. Because I think we've both been able to improve each other's business.
Yeah.
Our employees are receiving kind of better healthcare, and they have better healthcare outcomes. And we've pushed you to look at other areas around healthcare or, you know, kind of cancer care or some of these additional services that helps your bigger book of business.
Okay. So there's a myth that moving from insurance to a trust is challenging, and actually sometimes is there a point of moving from a insurance to a trust? Do you feel that's a myth, John, or?
I guess a bit of a loaded question, but yeah, I think it is a myth. But going into it with your eyes open and knowing what you're trying to achieve and what the outcomes are going to be are really important. Having a 2 or 3 year plan. You know, this isn't just another insurance vendor that you churn because it's cheaper, and then you churn it again kind of 1 year later. So I think if you are strategic, you are focused, you are intentional, it's not a myth. If you just think, you know, we're going to do something short term, we're going to save the kind of insurance premium tax, that's a very kind of short-term way of thinking, and I don't think you're going to get the goals and the outcomes that you want. Because once you've made that saving, it's kind of gone after year one.
Yeah.
You're not going to kind of continue to get it every single year. But then you've opened up a healthcare trust. It may not be, you know, the wisest thing if you have enriched your benefits. You may not be able to get them elsewhere. So having that long-term view is the important thing to make sure you're going about it in the right way and you're seeking the right outcomes and end goals for you and your business.
Great.
But I think, you know, we leaned into you really heavily to help support, you know, the whole legal, procurement, finance kind of setup.
Yeah.
If we hadn't had that guidance and advice, it would have been difficult. And it would have been difficult for me to help those teams understand exactly what we were going into, why we were going into it, and what they needed to do to kind of help support us kind of make it. So I think that education piece up front really helped us. And it helped our other teams internally kind of get over this.
Great.
And I mean, another surprise or downside, I mean, I don't think I've spent as much time with our finance team as I have kind of working with this. So, you know, it does become a real kind of partnership between,
Yes.
you know, finance, legal, HR, to make sure that we are delivering in a compliant way, in a sustainable way, and for, you know, HR, we are getting the right outcomes for our employees.
Great. So if you had to summarise in 3 words what a trust has delivered to yourself and Workday, what would those 3 words be?
I do 2, which is happier employees, that's for sure, and healthier. So, you know, we are seeing this. We are seeing changes in our health screening data across the group. there are areas that we still need to focus on, and they are on our list. But, by the measures that we have available, they are happier and they are healthier.
Okay, thank you very much. Thank you, John.
Thank you.
Thank you. We're right on the clock, but I do like to ask some questions, so I'm going to try and combine a couple so that there's one each. I think, firstly, John, for yourself, you've covered a little bit of this, but just the headlines, 2 questions together. But what approach did you take to map out everything that you offered? And then how did you present it to your people? But in with that, you obviously had your own team and their ideas about how you wanted to change the journey. How did you present that to them? And did you get their feedback before you implemented it? What was the employee part in that?
Yeah, I mean, we hired an employee benefits communication person, and they were not a benefits person, so they were coming to this with an outsider's view. And I think that really helped, because we're so in the weeds with all of this stuff. We never kind of focus on how do our employees kind of navigate this. I mean, I would say we didn't ask our employees what they wanted, but we could see that some services were really well utilised and others weren't. So we kind of did a checklist of what are all the things that we have available. Do we still need them? Do we still want them? And are they adding value? So as we kind of went through that, we were able to identify kind of duplication, triplication. And for us, looking at that myself, I was just like, yeah, if I'm an employee and I've never used medical insurance, or I've used it once, I don't know how to get to where I need to get to. And that's a really frustrating experience. And, as Workday, we have internal tools like Peakon. Our employees are very vocal and they're very quick to kind of tell us what's working, what's not working. So we do have an ability to kind of respond and react to that. But we kind of put the employee at the centre and kind of said, how do we just make all of this easy? And we knew, based on stress and diet and sleep, they were the things that were causing problems. So we wanted to make that, it's literally one call. It's call the bat phone and you will start to get the help that you need.
Thank you. And whilst we are 2 minutes down, we do have a 10-minute changeover time for next session. So, Sharon, just coming to you, there's a couple of questions around, that sounds great, but what about if we're a smaller employer? And what could we have a trust, and how might we have nutritionalists or sleep counsellors or that more holistic? How might a smaller employer go forward? Is it possible for them too?
Yes, absolutely. I would say a smaller employer of 50 upwards. We do have smaller clients as well, and that can be through a master trust or a sort of combined trust as well. So in a way, size doesn't matter, and it's about working with that company to understand that client, to understand their health and well-being needs, and around where those gaps that they want to provide to their employees as well.
Perfect.
I'd say we're not large either.
Okay.
We were, 350 employees in the UK when we started, but not all of them are office-based. So if you think there's maybe 175 of those who are office-based, that to me was kind of like the minimum entry level for bringing these services on site.
Great.
But you don't need to have them on site, you can have them near site as well.
That's really helpful.
And having people who can, the thing that was kind of happening is all of our employees were going to the hospital on London Bridge. I forget the name of it now, but very expensive hospital. HCA, there you go. Thank you. So all of our employees were automatically going to HCA. And it's very difficult to kind of get someone to change where they're directing employees, even if near their house there's a really good local hospital. And being London Bridge, if you live, I live in Twickenham, that's a train journey in. If you've got a bad back and you're sat on a train, that's painful. So we were thinking, can we inform our employees about hospitals that they're going to, not just default send them to the Priory or send them to HCA. Not that they're not great places to go, but they are somewhat expensive. So. It doesn't always have to be the big brand name kind of hospital. You can find local physios or local counsellors as well.
Super helpful. Thank you, John. Thank you, Sharon.
Thank you.